If I ask you to guess what is the most severe pain a human has ever experienced, most of you might think that the labor pains or the pain which a mother suffers during her childbirth is the most severe pain. Obviously, that is the most severe pain which a woman can ever experience. But that is a normal process of our existence. But if I say you that that is not the severe pain which a human has ever experienced, don't take a jolt. It is true. And the condition in which the patient experience very severe pain is called as trigeminal neuralgia. Trigeminal neuralgia is a pain which a person experiences on one side of the face. Now, this can be triggered by a simple tasks like brushing their teeth or combing or simple blowing that might trigger the pain. The pain is so severe and so worrisome that most of the people also suffer emotional disturbances, and suicide risk in such cases is also very high. Hence, it is called as a suicidal disease. So, the people who are suffering from trigeminal neuralgia, we will just try to dive in into the topic and we will try to understand what exactly a trigeminal neuralgia is and who are more prone to that disease and how to identify that this is the problem in a person who is suffering from facial pain and what are the treatment options available. First of all, we'll try to understand what exactly the trigeminal neuralgia is. As you know, most of our body is supplied by nerves. Now, these nerves can be of two types. One is sensory and one is motor. If I want to move my hand, the motor nerves are used. But if I want to feel something, the sensory nerves are used. Now, in the face, there are muscles and as well as the area which is the facial skin which is there, it also has some sensations. The face has some normal sensations and some special sensations. The normal sensations are like touch, pain, and the sensations to the cold and hot. Now, the special senses are hearing and also the taste. So, these are the special senses. Now, we will coming to the understanding of trigeminal neuralgia, it affects our normal senses, that is sensitivity to pain. Now, how does this happen? Most of the face is supplied by a nerve called as trigeminal nerve, which is also called as the fifth cranial nerve. The nerves which are originating from the brain are called as cranial nerves, and the nerves which are originated from spinal cord are called as spinal nerves. So, we have in total 12 cranial nerves, out of which trigeminal nerve is one of the cranial nerve. Now, trigeminal cranial nerve is a fifth cranial nerve which supplies complete half of the face. So, on one side of the face it is supplied by the right sided trigeminal nerve, and on the left side it is supplied by the left sided trigeminal nerve. Now, what happens to this nerve that the patient feels so lanceolating electric shock like pain which is so severe that he can't bear it? What happens is the area or the point where the nerve is exiting from the skull is like a bone. So, when the nerves are exiting outside, it is covered or surrounded by the blood vessels. So, in most of the cases, like 95% of the cases, in which cases we have done imaging, like MRI and other things, they have suggested that the blood vessels have dilated and that is causing compression of the nerve, and that compression is for a very short time. So, during that point of time the patient experiences the pain. Now, this touching of the blood vessels to the compression from the blood vessels to the nerve is elicited by small activities like brushing or like combing or blowing or smiling. So, these things, or chewing most importantly, even if a patient tries to chew something, the pain starts. Now, this pain does not remain continuously, it comes in clusters. Like if a pain has come now, then it may go again and the patient completely remains normal for a duration of time, and then again the pain might start. Now, the pain, as it is very severe, the patient is frightened to try to understand and worry about the next episode. He is totally worried that when the next episode is going to be, what might I be doing, and how severe the suffering could be. We have tried to understand what exactly is causing the trigeminal neuralgia. Why it is electric shock like sensation? Nerve is like, it is a conductive medium of any senses. So, whenever something is touched or compressed upon the nerve, it gives us a electric shock like sensation which is felt as a pain. This type of pain is called as neuropathic pain. So, trigeminal neuralgia is a type of neuropathic pain. Now, this is a short understanding about why does the trigeminal neuralgia happen. Now, what is exactly, how do we come to know that this is the cause? So, most of the times the patient history and the severity of the pain and the clinical examination is sufficient to diagnose a case of trigeminal neuralgia, but sometimes imaging might be needed. So, we generally prefer MRI for imaging diagnostics. Now, once we have diagnosed the case of trigeminal neuralgia, here comes the most important point, that how are we going to treat it. So, there are three modes of treatment. I would touch upon the two most important, and I will come on to the a latter non-invasive treatment. Non-invasive means in which we are not doing a surgery for the reduction of the pain, but we are using minimally invasive approaches. That means there is no cut, there is no stitch, or I am not entering any part of the body. So, we are, whatever we are doing it, we are doing it from the outside. So, therefore, they are called as non-invasive. Invasive surgeries, all surgeries are invasive. Invasive means you are just cutting out the body part and you are going in, you are correcting something, you are coming out. So, we will touch upon the medical management, we will touch upon the surgical management, and then we will try to come to the non-invasive modes of management. So, first thing is medicines. As we have already discussed, it is type of neuropathic pain. So, we are going to use medications which affect the nerves and which decreases the, what do you say, the transmission from the nerve. So, therefore, the pain severity is decreased. The most important drug used in this situation is carbamazepine. So, the dosage and all, it depends upon the severity and the frequency, and the other neuropathic drugs like gabapentin, pregabalin, others can be used. Now, coming to the surgery. See, as we have already discussed the cause, most of the trigeminal neuralgias are because of the vasodilatation around the trigeminal nerve proximal to the Gasserian ganglion. So, generally what neurosurgeon does is, he goes to the area where the vessels are dilated and he does the microvascular decompression. So, this is the surgery which is indicated to permanently cure the trigeminal neuralgia cases. But obviously, it is an invasive surgery, it is near the brain. So, obviously, the risks are also on the higher side as compared to the medications in the non-invasive treatment. Now, I have already touched on medications and surgery. Now comes the non-invasive management. Now, if the pain is not getting controlled by medication, and as the surgery is invasive, few may not opt for surgery because it is a brain surgery, people are frightened about it, there might be possibility of bleeding inside. So, if you are worried, then what we can do in such scenarios where medicines are not controlling the pain and surgery, the patient is fearing for it. So, now we will go for non-invasive management. What we do in the non-invasive management is, we try to reach the ganglion through introducing a needle from the angle of mouth, and we try to reach the foramen ovale where this nerve is exiting from. So, as we go near the foramen ovale, we try to use a radiofrequency ablation machine, and we try to find out the sensory and motor prepositions, and we locate where exactly our needle is, and this is done either under the fluoroscopic guidance or a CT scan guidance. So, you radiologically you are assessing where your needle exactly is, and along with that you are also taking help of the radiofrequency ablation machine, where the sensory and motor signals will indicate where your needle tip is. Now, after going near and approximately near the foramen ovale and confirming with the fluoroscopic guidance or CT guidance, whatever it is available, then you introduce a 5 RF catheter, guide through the spinal needle. Once it is near the ganglion, you try to give bursts of radiofrequency ablation. So, what exactly it does is, it completely destroys the nerve which we are targeting. Like, if patient is having a pain around the mandibular region or the jaw region, we are going to target the mandibular nerve, which is the mandibular division of the trigeminal nerve. So, this is one of the part. If the patient is having pain in the upper jaw or near the lateral side of the nose or something, then you can target the maxillary division of the trigeminal nerve. And if the patient is having any pain in the supraorbital region or around the area of the eyes, then you can target the supraorbital nerve or the facial nerve. So, the location where the patient is complaining of pain, that needs to be determined, and that area needs to be targeted, and RF needs to be done. Now, after doing RF, as we are ablating is nothing but you are destroying the nerve. So, once the nerve is destroyed, obviously it comes with a pain relief. Even though the vessel is touching the nerve, it will not carry the impulses. So, therefore, the pain is decreased. But how long the pain is decreased? See, now as we are destroying the nerve, we are not completely destroying the nerve. This nerve is going to regenerate, but it is going to take some time. The time is not particularly specified. It depends upon how good quality RF ablation you have done and the severity of the proximity of the nerve where you have done it. It depends upon many factors, even the patient factors also come in. But on an average, you can have a pain relief of around 1 year to 2 years. So, patient can be having pain relief. Now, the most important question from the patients is, sir, once the procedure is done, is my pain relief immediate? So, I generally say them, no, it takes time. Over a period of next 5 to 7 days, the pain will slowly and insidiously comes down. It doesn't come down suddenly, because if you don't counsel the patients prior to the procedure, then they become anxious that why hasn't the pain come down. So, it takes some time for the procedure to act and the pain relief to be obtained. Now, the second point is, sir, is it 100% pain relief with this RF ablation? No, 100% pain relief is not guaranteed. The pain relief will be somewhere around like 60 to 70% pain relief. The rest of the 20 to 30% can be managed by the medications. So, this is one more query which I generally receive from the patients. So, this is in crux, everything is about the trigeminal neuralgia. Thank you.